diseases, general pediatrician, and parental and internal medical nutrition therapist, once in the charge of the hospital infection control service of the City of Francis General Hospital. And I would like to introduce her title, Chakras and Energies Imbalances in Patients with Urinary Incontinence and Sexual Dysfunction after Prostate Cancer Surgery.
Ela colocou o outro. Oh, okay. I think I will present this study, but there is another study about kidney cancer that I can present in the second time.
Yes, thank you.
Okay, thank you. Hi, good morning, good afternoon, or good evening to everyone. My name is Juan Weili. I'm a medical doctor from Brazil. My presentation today is chakras and energy imbalances in patients with urinary incontinence and sexual dysfunction after prostate cancer surgery. I would like to thank the organizing committee to invite me to this conference. And to start this presentation, I will divide this presentation in Western medicine point of view and traditional Chinese medicine. And let's start. Urinary incontinence is defined as unintentional loss of urine, being a symptom of a problem on the urinary tract. In the case of prostatectomy surgery, urinary incontinence is known to be a side effect, affecting 6 to 8% of men who pass through this surgery. There are three types of incontinence: overflow incontinence, stress, and urge incontinence. And let's start with the stress urinary incontinence. This type is characterized by the weakness of pelvic muscles, and the main way of a cure of stress urinary incontinence is exercises in order to fortify the pelvic muscles. And this exercise is entitled Kegel exercise. The second type is the overactive bladder, also called urgency incontinence. This process of this type of incontinence is a mixed signal sent by the brain that understands that the bladder needs to be emptied, and when it's not completely full yet. And the main consequence is the lack of control of the bladder every time the urge to urinate appears. There is also an overflow incontinence, which happens when the bladder doesn't empty completely when the patient urinates. A small amount of the remaining urine leak out later because the bladder becomes too full. And the patient may or may not feel the need to urinate before leaks happen. In Western medicine, therapy for urinary incontinence includes behavioral therapy, physiotherapy such as Kegel, and other similar exercise, medications, and surgery. And duloxetine is the first licensed drug for the treatment of urinary incontinence, with rates of success around 66%. According to literature, prostate cancer is the most common cancer type in male patients over 50 years old. There are different kinds of prostatectomy, such as radical retropubic prostatectomy, laparoscopic prostatectomy, laparoscopic radical prostatectomy, and robotic assisted laparoscopic radical prostatectomy. All these different kinds of surgeries associated with surgical urinary incontinence and urinary incontinence rates after prostatectomy vary in the current literature, and it can be as high as 80%. And after surgery, the recovery of normal continence can range for 6 to 12 months in most cases. And given this time, the surgery asks a lot of time from the patient and does not give an immediate cure. Now I'd like to talk about a case I treated myself in 2006. that is the base case of how I treat my patients nowadays in a variety of symptoms and disease. This specific patient was a 70-year-old male patient who reported pain in the legs and was diagnosed with kidney iron deficiency according to traditional Chinese medicine. He received treatment with Chinese dietary counseling, acupuncture, and auricular acupuncture associated with apex bloodletting. And with the treatment done, the pain in the legs diminished, and the pain was submitted to an interview after this treatment. In this interview, 30 days after this treatment, the patient revealed that his eye pressure had also lowered with the treatment, and his ophthalmologist confirmed. During the treatment I did, he had not reported to me that he was treating for glaucoma in the last 40 years, and with no improvement of his condition using only eye drops. And with the treatment performed, his intraocular pressure lowered from 40 to 17 mmHg. And this interesting case became the cornerstone of all my studies in the field, trying to comprehend how the treatment based on the root of the problem could treat different disease and symptoms simultaneously and using the same methods, and in addition, even symptoms the doctor or the patient did not know about it. In traditional Chinese medicine, urinary incontinence is associated with kidney iron deficiency, and other articles of mine demonstrated that the surgical environment and any surgical procedure may harm the general energy of the patient, causing energy deficiencies. And therefore, treating these energy deficiencies would be beneficial for the patient in their post-surgery period. In this case, patients who just had prostatectomy surgery. Now I will describe a case report of a patient of a 60-year-old male patient that had the symptoms of sexual dysfunction and urinary incontinence after performing radical rectopubic prostatectomy surgery due to prostate cancer. And the patient also had used testosterone blockers to diminish the possibility of acquiring a new cancer, and duloxetine to control the urinary incontinence. And a year after the surgery, he still had the symptoms of urinary incontinence, even with the use of this medication. And the background of the patient shown that he already had sexual dysfunction a year before the surgery. 2 years before the surgery, he had sexual intercourse 4 times a week. A year before the surgery, he felt his sexual appeal diminished, what worsened after the surgery with no capacity of having erections. And he went to the urologist who recommended treatment with sildenafil, and the patient decided not to perform the treatment with this medication because he had friends who had died from the use of this medication to improve sexual function. And the urinary incontinence started soon after the surgery. The patient did not want to use diapers and penile diapers too, and despite having them at home. And this situation altered the self-esteem of the patient very much and causing symptoms of depression. And he was diagnosed with kidney iron deficiency, Qi deficiency, blood deficiency, and heat retention according to traditional Chinese medicine. And to start this treatment, I constructed a diet based on traditional Chinese medicine nutritional therapy, asking for the patient to avoid the intake of all dairy products, especially when the cheese is melted, raw food, sweets, and cold water, and only using lukewarm water, and avoid the ingestion of soda, coffee, and matiti because these foods could imbalance the kidney energy meridian that is responsible for the containment of the urine in the bladder, and to avoid all this medication, all this food, that chocolate, fried food, coconut, honey, alcoholic beverages, eggs, and to prevent the formation of more internal heat that is the cause, one of the cause of cancer formation. And here is I orientate to the patient to only eat boiled food or grilled food to take out the cold energy of these foods that was causing the lack of energy to contain the urine in the bladder. And here's to show you the auricular acupuncture sessions with apex ear bloodletting. This procedure were done to take out the heat retention that one of the energy imbalances leading to the formation of cancer and other symptoms such as anxiety, dermatitis, and many other disease can come for the heat retention energy imbalances. And I use all the use of moxibustion is to replenish the energy of the kidney here to because his kidney energy was empty, and that is why it is causing the urinary incontinence according to traditional Chinese medicine reasoning. And this kind of procedure called moxibustion is to replenish this energy of the kidney. And with this procedure and with all the treatment done with the dietary changes and auricular acupuncture, and with this procedure, we can improve the patient's condition, improving his urinary incontinence. And also, here are the points used to treat the energy imbalances of the patient. Here's to show you the anxiety points. Here's to sleep well, because if the patient doesn't sleep well, you cannot replenish the kidney energy that is filled during the sleep process. Here's the kidney point, the gallbladder, the liver, spleen, heart, lungs, small, large intestine. Here's the point to sleep well too. And the apex ear bloodletting, okay. And here is to show you that this patient, I did the radiesthesia procedure to measure the chakras energy. And measuring this chakras energy, I'm measuring the internal organs energy too, because there is a correlation of the chakra with the 5 massive organs in traditional Chinese medicine. The first chakra corresponds to the wood element in the liver, and the second chakra corresponds to the water element representing the kidney. The third chakra is the fire element, corresponds to the heart. The fourth is the metal, here's the wrong, it corresponds to the lung. And the fifth chakra is the earth element, corresponds to the spleen. All these chakras were in the lowest level of energy, meaning that all his internal energy were in the lowest level of energy. It was the cause of the formation of prostate cancer, because cancer in traditional Chinese medicine is caused by the deficiency of the energy and the heat retention that is caused by the decreased energy of the energy can cause the formation of heat retention. And the association of this deficiency with the heat retention caused the prostate cancer, that the patient did the surgery, but yet didn't treat these energy imbalances that was leading to the complication of the of the surgery, leading to more sexual dysfunction and urinary incontinence. And that is why if we treat all these energy imbalances using highly diluted medication and crystal-based medication to replenish this chakras energy, it was important to treat this urinary incontinence and sexual dysfunction, and also the energy imbalances that leaded the formation of his cancer itself, preventing, in this case, the formation of metastasis and the formation of other cancers in other sites of his body. And here is only to show you, after 2 sessions of acupuncture, the patient started feeling improvement of all his symptoms, feeling more disposition because he was with no energy, and with the replenishing of the energy, he had more disposition, happiness, and energy to do all his daily activities, and was completely recovered from the urinary incontinence within a month of treatment. And even with the improvement, the patient chose to continue the treatment with me until today to balance his energy furthermore. And he continued to do the acupuncture sessions and continued to use medication until today, 2 years after the surgery. After more than 1 year, he received a new chakras energy measurement, and he continued to be with the minimum level of energy beside the improvement of his symptoms. The measurement was already in the lowest level of energy. This means that the replenishment of this chakra is not very easy to do. And he is still maintaining the intake of these medications. And the patient reported that when he does not do the acupuncture sessions and does not use the medications, he feels less disposed with sadness, negative thinking, and with less energy to work. And his urology exams concerning cancer evaluation regarding prostate-specific antigen all appear as normal. And only to show you that in all my studies and publication, I also like to show you the differences between a Western medicine point of view and traditional Chinese medicine. Using this tree-like metaphor, this tree has a trunk with several branches. Each branch represents one medical specialty, and coming out of each branch, there is some leaves that represent the symptoms and disease treated by each specialty. And here, the leaf level is where the Western medicine treats. And what I treat is not in the leaf, but the root of the tree, that if we treat the root of the tree, you can treat all the patient's symptoms and disease at the same time as in the glaucoma patient that I show you in the beginning of my presentation. And always considering the external pathogenic factor as the beginning of the formation of the disease, mainly the infectious disease such as respiratory tract infection and so on. And here's only to show you that the main idea of this study is to understand how Western traditional Chinese medicine sees the symptoms and signs from two different perspectives. In the treatment of urinary incontinence, post-cancer prostatectomy surgery, as TCM aims to see the patient as a whole. The first important step for the treatment is to analyze the patient history, diet, environment, lifestyle, emotional aspect, etc. And as said by Elizabeth Craig in the Hippocratic Corpus, it states that the importance of considering the climatic factors when diagnosing and treating any disease. On the Yellow Emperor book, the influence of the external pathogenic factor is also discussed. And in the Yellow Emperor Classic of Internal Medicine, it states that in order to perform a diagnosis of any pathologies, it is important to analyze the symptoms and classify them into yin-yang in order to perform the diagnosis. And the bladder, according to five-element theory, is a hollow organ related to the kidney meridian or massive organ. And the kidney meridian is linked to the water element, and the corresponding emotion is fear. Yang energy is important to maintain the organs up on their places. And when there is a lack of yang energy, there is a tendency of the internal organs to fall. And this is why the patient with urinary incontinence cannot maintain the urine inside the bladder due to kidney yang deficiency. And the patient on the case report had kidney yang deficiency because he felt very cold in the body, especially on the extremities such as hands and feet. As yang energy is responsible for warming the body, the deficiency of yang energy can lead to the patient feeling colder with cold feet and hands. And this is why the patient was oriented to eat boiled and grilled food and avoid raw food, because all this food has cold energy and worsening the yang deficiency. And the patient was also oriented to drink lukewarm water because the energy of water is naturally cold, and warming the water changes the energy from cold to neutral, improving the yang energy. And as the patient had kidney deficiency, the patient was oriented to eat food with black colors, such as black beans and black dried grapes, because food with that color toned the kidney energy. And with the exception of coffee, soda, Coke, which are black color but may harm the kidney energy, and the patient was also oriented to eat pig's kidney to help the improvement of kidney energy that was low. And the patient on the clinical case of this presentation had other deficiencies besides kidney yang deficiency. This happened because the energy inside the body are all interconnected, and treating the imbalance of yin yang, qi, and blood, it is possible to treat several symptoms and disease at the same time. And when there is some deficiencies in the one or the combination of these four energies, there is formation of internal heat as shown is in this slide. And cancer in traditional Chinese medicine develops when the patient has deficiency of energy and formation of internal heat. Therefore, the treatment proposed to treat post-cancer prostatectomy urinary incontinence is treating at the same time the energy imbalance that led to formation of cancer itself. And this was part of the study I presented in 2015 at an acupuncture research conference at the Faculty of Medicine of Harvard University in Boston, entitled Acupuncture Viewed Holistically Can Treat All the Patient's Disease Simultaneously. And this summary of this study states that if we treat the patient's energy imbalances, we will treat all the patient's symptoms at the same time, even if the doctor does not know the patient has such a symptom. And with this type of reasoning, we will be able to treat all disease of all specialties at the same time, as we treat, in this case, the root of the problem and not just the symptoms. And in order to make an energy deficiency, to make the diagnosis of which energy deficiency the patient has, the patient is submitted to some 5 questionnaire proposed in this table. To see if the patient have blood deficiency is asking if he have daily bowel movement. If not, the patient has blood deficiency. Qi deficiency is when the patient have sweating during the day without doing any exercise. Yang deficiency is when the patient feel cold in the extremities of the body. And indeficiency is when the patient feel hot in the extremity or hot flashes, very common in women in menopause. And heat retention, you can ask the patient if he have dry mouth, bleeding gums, bad breath, acne, or redness in the skin, abdominal pain, microhematuria, or itching. And according to Hippocrates, we need to make our food our medicine, or our medicine our food. That's why the first step of all our treatment is to change the dietary aspect that is causing the energy imbalances of the patient, leading to the formation of the disease. And here is to showing you the apex dilating is a procedure to take out the heat retention that I show you in the previous slides. And here is to show you the chakra and the correspondence on the 5 massive organs in traditional Chinese medicine. The generation cycle is the cycle that you need to treat the patient according to the sequence of this cycle, okay? And here's the medication that I usually use in this patient. And for example, if you begin to treat the first chakra, the liver, the next chakra is the 3rd chakra, that's the heart, you need to treat after with sulfur. And the next chakra is the 5th chakra, that is the spleen, you need to use calcária carbonica. And the next element is the 4th chakra, you use silicia. And the last chakra is the natrium muriaticum. You can change the sequence the beginning of the sequence, and this sequence depends on what you achieve at the anesthesia procedure. I'm showing you this case that the patient has had no energy in any of the chakra, but there can have some cases that the patient could have energy in one or in two and doesn't have energy in others, and you need to change and verify according to the anesthesia procedure which medication you need to use. And here's only to show you why I'm using highly diluted medication instead of high concentrated medication. Because if you use high concentrated medication to treat this patient with urinary incontinence and sexual dysfunction, you can decrease even more his vital energy and could worsen his symptoms. And that is why when you use high diluted medication to replenish the chakras energy meridian, you will improve his organic process and reducing the formation of internal heat, leading to an improvement of all his symptoms and disease. And here is to show you the Hippocrates quote, first, do not harm. The conclusion of this study is that it's important to treat, according to this case report, patients with urinary incontinence, post-cancer prostatectomy surgery have energy imbalances and chakras energy deficiencies as an underlying cause, and to have a successful treatment of this kind of patients, the correction of these energy imbalances through Chinese dietary counseling, auricular acupuncture, apex ear bloodletting to take out the heat retention, moxibustion to replenish the energy, and the use of high diluted medication are important tools to treat this kind of patients. And the integral treatment of this patient is significant, and not only the localized treatment focus on the symptoms. And here's to showing you the article that written by me, published in July this year, that I'm using Chinese reasoning, using high diluted medication homeopathy, because in China they usually use Chinese herbal medicine to treat the energy imbalances in the internal organs. But here in Brazil, I have some difficulties to find these remedies, and that is why I need to create another theory using the remedies that I have here in Brazil. And this kind of medication is very cheap, and there many patients that can use this kind of treatment without and have a very successful results. Here's the publication of this article. It was published this year too, in June 2020. And here's another article I presented yesterday to replenish the internal energy and treating energy imbalances in the prevention and treatment of cancer. In this article, I'm showing you that cancer formation is from the energy deficiencies and heat retention. And I showed in using 3 case report yesterday that if we replenish the chakras energy and treat all the energy imbalances and taking out the heat retention using Chinese dietary counseling, auricular acupuncture and apex ear bloodletting, and using this high diluted medication, I can treat a cancer patient without using the necessity of using chemotherapy or radiotherapy. But more studies we need to do regarding cancer treatment with more patients, with more cancer, different cancer, to show the effectiveness of this treatment in all kinds of cancer formation. And here's another Hippocrates quote: if someone wishes of a good health, one must first ask oneself if he is ready to do away with the reasons for his illness. Only then is possible to help him. Thank you for your attention. If you have any question, please ask me. I will be very happy to answer you. Thank you.
Thank you for your talk. Any questions for Dr. Huang Willing?
Good. Can I, if you don't have any question, can I begin the second presentation?
I think we can go for the next talk, right?
Okay. The next talk is mine too.
Yeah, you can go ahead, right?
Okay. Hang on. My second talk now is about chakras energy deficiency as the cause of kidney cancer. This presentation is also based on the Hippocrates Code that said that it's important to consider other ancient medical traditions prior to the knowledge we have nowadays. And for this reason, I choose to develop this lecture using traditional Chinese medicine reasoning. And this presentation will be divided into what are the considerations made in Western medicine regarding kidney cancer, and then we will talk about how our reasoning started regarding the treatment made based on the root of the problem. And after, I will approach a case study about a patient with kidney cancer, and I will show you how she did her treatment in Western medicine treatment, and how I approach in traditional Chinese medicine reasoning that was leading to the cancer formation. Kidney cancer, also called renal cancer, is one of the most common types of cancer. It usually affects adults in their 60s or 70s, and it's rare in people under 50 years old. In many cases, there are no obvious symptoms at first, and kidney cancer may only be found during tests for another condition or reasons. If there are symptoms, they can include blood urine or darker urine, a persistent pain in your lower back or side, just below the ribs, a lump or swelling in the side, although kidney cancer is often too small to feel. And according to Western medicine, the exact cause of kidney cancer is unknown, but some things can increase the chance of developing it, including obesity, smoking, hypertension, inherited genetic condition, long-term dialysis, etc. And in Western medicine, the treatment for kidney cancer depends on the size of the cancer and whether it has spread to other parts of the body. And the main treatments are surgery to remove part or all the affected kidney, cryotherapy or radiofrequency ablation, where the cancerous cells are destroyed by freezing or heating, and biological therapies, medicine that can help stop the cancer growing or spreading, and embolization, a procedure to cut off the blood supply to the cancer, radiotherapy using high energy radiation to target cancer cells and relieve symptoms. And for you to understand the way of thinking, I will show you the case report I presented in the first presentation about the glaucoma patient. I want to repeat again, and only to show you that how I did the reasoning of the patient I treated here in the cancer patient, using the same reasoning in the case report I did I treated in 2006 related to the pain, the patient that had pain in the legs, and improved his glaucoma condition of his treatment. And now I will describe the patient of kidney cancer. She is a female, 69-year-old. And one night she was taken by a sudden and strong pain and was taken to the hospital where her gallbladder was removed. She had gallbladder stones, and after the surgery, after a computer tomography scan was performed, when it was identified that his left kidney was completely damaged, and kidney removal surgery was performed, and the biopsy to the patient's fright, cancer was found in the left kidney. As the kidney had been removed, there was no need for chemotherapy or radiation therapy. And after 3 months, the patient underwent a second surgery on the bladder where the onset of cancer was identified. 6 doses of BCG, a weekly application, and now after 6 months, the doses shall be repeated. And when the patient arrived at my clinic, her main complaint was about her self-esteem and how she felt mutilated by the kidney and bladder surgery. And after removing the bladder, the patient used it. Oh, yes, she needs to remove the bladder too because they discovered that there were metastases in the bladder. And she searched for 3 different doctors to see if the bladder need to be removed because she need to use a bag urine in her abdomen to collect the urine, and that's why she was very sad and her self-esteem was very low, and that's why she went to my clinic to treat this condition. And after the treatment I did, she felt very much stronger because she was happier again with the better self-esteem using the Chinese dietary counseling or weekly acupuncture with apex batalating. And I did the chakras energy measurement, and which showed that all her chakra were in the lowest level of energy too. That is why, according to traditional Chinese medicine, this lack of energy was leading to the cancer formation with the heat retention. And that is why treating these energies, these harmonies, and replenish the chakras energy, she was able to recover all her energy to continue to live, and her self-esteem was improving too. And on the condition that led to the cancer formation was treating too, because we need to treat the root of the problem, that was the lack of energy in the chakras that was leading to the cancer formation. And using this kind of treatment, all the cause of her problem were treated at the same and treated at the same time. And also I use the homeopathy medications. Here the same use in the first presentation, and to replenish all these chakras energy using the theory created by me. And she went to the acupuncture sessions every day, and she followed the dietary counseling and used the homeopathy and crystal-based medication to replenish the chakras. And here is to showing you that when Western medicine treats cancer in the leaf level of this tree, but in this metaphor, I'm treating the root of the tree, that is the energy imbalances of the 5 elements and the yin and yang energy imbalances. And that is why if I treat the root, all the patients' emotional psychiatry symptoms of this patient were treated at the same time, and improving the condition that led to the cancer formation, and having in this case less propensity to have metastases or other cancer formation in other sites of the body. And here is to showing you the necessity of balance the yin and yang energy to treat all the health problems of all our patients. And if we treat these imbalances, we can achieve a cure or a very good improvement of all the patient symptoms. And here is showing you the necessity of treating all these four energies to improve the health of all kinds of patients. In this case, her disease were improved. Her symptoms, emotional, physical symptoms were improved too. But she didn't return after the coronavirus pandemic. And I don't know how she was until now, since the beginning of this year. And here is to show you that the cancer patient has energy deficiencies and the formation of heat retention. And that's why we need to treat this heat using apex ear blood dilating and reducing the ingestion of food that can increase the formation of internal heat. That is avoiding the ingestion of chocolate, fried food, honey, coconut, alcoholic beverages, and melted cheese, to reduce the heat formation, and that is predisposing the patients to acquiring cancer or have other disease such as diabetes, hypertension, infectious process, all came from these energy imbalances. And her condition were in the lowest level of energy in all her chakras, and the use of that treatment. Here is the questions that I usually question the patient to see their energy imbalances that I did in my first presentation. I want to repeat the 5 elements, this generation cycle and control cycle. And here is to showing you that in my presentation yesterday, I showed the progression from health to disease is from 1 to 5, number 1 to 5. In the first 3 phases that are the patient presents symptoms, but the laboratory exams are normal. In the phase 4, where Western medicine did the diagnosis only in the late phase, in the late phase 4, where the patient has symptoms and there are laboratory exams alteration. But in this presentation, I'm showing the necessity of treating the energy imbalances before showing the alteration in the laboratory exams, because in this phase is too late, the diagnosis. And in the phase 5 is when the patient has irreversible thyroid lesions such as cancer formation. But in my presentation yesterday, I'm showing you that when the patient reaches the phase 5, you can lead the patient to the phase 4 and 3, because using this kind of treatment, you can transform the malignant cell to be benign, according to one case report I showed you yesterday, or leading to the phase 3, where there are they're normalizing the laboratory alterations, only treating these energy disturbances and replenishing the chakras. And in patients diagnosed with cancer, the treatment of this lack of energy may serve as an adjunct to the chemotherapy treatment, and that the patient is already undergoing chakras energy treatment was important to replenish the energy that was very low, leading to the formation of cancer. And that is why we need to associate the leaf level of the tree with the root level of the tree. Because if you treat only the leaf and don't treat the root that is impaired, the patient could have another formation of very serious disease, leading to more cancer or other disease formation. And by replenishing this energy, it decreases the formation of internal heat and thereby reduce the chance of metastasis or formation of another cancer in another location. Here is some of publication of mine the explaining that all these Western diagnosed diabetes, hypertension, myocardial infarction, and many other disease are caused by the lack of the energy in the chakras. And replenishing this chakras energy, you can decrease the use of medication in diabetic patient, or reduce the hypertension in these hypertensive patients, and reducing the use of antihypertensive medication, or even cure this hypertension, only replenishing the chakras energy. And here is to showing you that patient that has myocardial infarction, they have also energy deficiencies, that if you don't treat these energy deficiencies, you can cause another myocardial infarction due to deficiency of energy, that can lead to the blood stagnation in any parts of the body. In this case, can lead to myocardial infarction, or can lead to stroke, or lead to thrombosis, and any other disease, different disease. And here's I'm showing you only a study that a research that they did it from 2015 to 2020, is studying 1,000 patients chakras energy. And I'm showing you that more than 90% of these patients that vary from 2 to 79 years old, they all these patients have no energy in all these chakras, meaning that all the internal organs of the patients are in the weakest level of energy. The first, the liver; the second, the kidney; the third is the heart; the fourth, the lung; and the fifth is the spleen. And this can explain why we are having more cancer in children, in young adults, and or other chronic disease such as diabetes, cancer formation, myocardial infarction in younger patients, that was in the past only we have this disease only in the oldest patient. Nowadays, you can see that all these diseases are happening in any ages, and that is why the importance of treating these energy deficiencies in all kinds of treatments, because even in the anxiety and depression, the headaches, the knee pain, all kinds of patients, if you measure the energy of the chakra, you can see that their energy are in the lowest level, because according to one doctor of US, this is because the implement of the 5G technology of the cell phones, the electromagnetic waves are causing the reducing the energy of the human body, leading to the disease formation. And here I'm showing you the importance to treat the root of the problem, not just the symptom, and considering the external pathogenic factor. And here is to showing you that the cause that are imbalanced, the roots, are the diet, wrong the dietary habits, and also the emotions that can balance the internal energy. The emotion can balance the metal, that's lung, is the sadness; the water, the excessive fear; the kidney, the wood is the excessive, angry; and the fire is the excessive, um, how can I say, happiness; and the earth element is the excessive worry. All these emotions, if not a chronic, and don't if we don't treat, it can induce the energy imbalances, leading to the imbalanced state of these five element theory. And here's to show you the necessity of use of high diluted medication instead of high concentrated, because if you use high concentrated, you can harm even more the vital energy of this patient, leading to more cancer formation or other disease. And that is why I'm using high concentrated, high diluted medication to treat this patient with kidney cancer. And the necessity of integrating the two kinds of medicine that nowadays are separated, but you need to have in mind what is the energy imbalances in the root level and the leaf level in Western medicine. Thank you. For the conclusion of this study is that it's very important to treat kidney cancer at the energy level in each patient, as cancer is seen as a result of the patient energy deficiency according to TCM. The replenishment of the chakras energy is important to their treatment to prevent the formation of metastases or other cancer in other sites. Also, it will prevent the formation of other chronic disease such as diabetes, hypertension, myocardial infarction, etc. And more studies should be done involving more patients with kidney cancer, studying their chakras energy meridians to confirm these results. These another Hippocrates called natural forces within us are the true healers of the disease. That is why we are using all regulation of the internal energies leading to an improvement or even cure of patients with cancer. Thank you for your attention. If you have any question, please ask me now. Thank you.
Thank you for your talk, doctor. Thank you so much. Any questions for Dr. Wang Weling? Any questions for Dr. Huang Weling? Okay. No questions? Okay, there will be a break.